Have you ever noticed your vision becoming a little blurry? Or maybe your eyes feel tired more often than before? For many people, these little changes can seem like just a normal part of aging. But what if I told you that these small warning signs could actually be your body's way of alerting you to something much more serious, something that could eventually lead to vision loss if ignored? Diabetes doesn't just affect your blood sugar. It can silently damage your eyes in ways that you may not even notice until the problem has progressed. That's why in today's video, we're going to talk about the 5 early signs of diabetic eye disease and how diabetes affects your vision. You'll want to stay with me all the way through, because knowing these signs could make the difference between protecting your eyesight or facing irreversible damage. And if you haven't already, make sure to subscribe, like, and leave a comment below. It really helps this channel reach more people who need this information. Now let's begin by understanding why diabetes and eye health are so closely linked. You see, the eyes are filled with tiny, delicate blood vessels that bring oxygen and nutrients to the retina, the light-sensitive layer at the back of your eye that allows you to see clearly. When blood sugar levels are consistently high, as often happens in diabetes, these fragile vessels can become damaged over time. This damage can cause fluid to leak, swelling, and even the growth of abnormal new blood vessels that disrupt vision. Doctors call this condition diabetic retinopathy, and it's one of the leading causes of vision loss in adults worldwide. But here's the key point. Most people don't notice symptoms until the disease has already advanced. That's why recognizing early warning signs is so important. Don't forget to hit that subscribe button so you never miss important health tips like this. The first early sign we need to talk about is blurred vision. Now, it might seem like blurred vision is just from needing new glasses, and sometimes it is. But in people with diabetes, blurred vision can happen when blood sugar levels fluctuate, causing the lens of the eye to swell or change shape. Imagine your camera lens getting foggy. It won't capture a clear picture. In the same way, your eyes can't focus properly when blood sugar is unstable. Studies have shown that even short-term spikes in blood glucose can affect vision. For example, a person might wake up in the morning seeing clearly, but by the evening, after a day of poorly controlled blood sugar, everything looks hazy. If this happens more than occasionally, it's not just about glasses. It could be your body signaling that your eyes are under stress from diabetes. And if you've ever experienced this yourself, let us know in the comments below. Your story might help someone else watching this video feel less alone. Another early symptom that often goes unnoticed is frequent changes in prescription lenses. Maybe you've found yourself needing new glasses more often than usual, sometimes even within the same year. That's not normal aging. For people with diabetes, this happens because fluctuating blood sugar levels change the eye's shape and focusing power. It's like trying to fix a clock that keeps changing its gears. No matter how often you adjust, the problem keeps coming back. In fact, many eye doctors say that when they see a patient who needs new prescriptions too often, one of the first things they check for is diabetes. So if you've been told you need stronger glasses again and again, it may be worth discussing with your doctor whether diabetes could be playing a role. And remember, if this information is helpful, don't forget to like this video so more people living with diabetes can discover it too. Now let's talk about difficulty seeing at night, another subtle but important sign. Many people over 45 notice that driving at night becomes harder, but with diabetes, the cause can be more serious. Damage to the retina makes it difficult for the eyes to adjust to low light conditions. Some people describe it as headlights having extra glare or street signs becoming harder to read in the dark. This is not just an inconvenience. It can be dangerous, especially if you're driving. Real-life experience tells us that people often chalk this up to just getting older. But if you have diabetes, it could be an early warning sign that your retina is being affected. Think of your retina like the film in a camera. If the film is damaged, pictures won't come out right, no matter how good the camera is. That's why noticing trouble with night vision should prompt you to take action. Before we move on to the next sign, make sure you're subscribed so you don't miss out on the rest of this important list. We've now covered 3 early signs: blurred vision, frequent prescription changes, and night vision difficulties. These are often overlooked or blamed on aging, but in someone with diabetes, they should never be ignored. In the next part, we'll explore 2 more warning signs, one that involves floaters and dark spots in your vision, and another that can lead to sudden, serious complications if not addressed. These could be the very signs that help you or someone you love protect their vision before it's too late. So stay with me, because the next symptoms we'll cover may surprise you. And remember, hit that like button, share this video with someone who has diabetes, and let's spread awareness together. One of the most concerning early warning signs of diabetic eye disease is the appearance of floaters or dark spots in your vision. You might notice these as small black or gray shapes, specks, or cobweb-like shadows drifting across your sight. While floaters can sometimes occur naturally with age, in diabetes they may signal something more serious: tiny blood vessels in the retina leaking or bleeding. When blood leaks into the gel-like fluid inside the eye, called the vitreous, it casts shadows that look like floating spots. This condition is often related to diabetic retinopathy, and it should never be ignored. Imagine trying to read a book or watch TV while small dark clouds keep moving across the page or screen. That's what many people describe when floaters become noticeable. If you ever notice a sudden increase in floaters, especially combined with flashes of light, it's important to see an eye doctor immediately, because this could indicate a retinal tear or detachment, which is a medical emergency. And if you find this helpful, please take a moment to like and subscribe. It helps this channel reach more people who need to hear these life-saving messages. Another early sign we need to discuss is seeing dark or empty areas in your vision. Sometimes this feels like there's a shadow or curtain over part of what you see. This can happen when damaged blood vessels in the retina cut off blood flow, creating blind spots. At first, these areas may be small and barely noticeable. You might only realize it when you try to focus on something in detail, like reading fine print or looking at someone's face, and a part of the image is missing or blurred out. Over time, if the damage progresses, these areas can expand and lead to partial vision loss. This is why regular eye exams are so important for anyone with diabetes, even if you feel like your eyesight is good enough. Many people think they'll know when something is wrong, but in reality, these changes can be gradual and subtle until they reach an advanced stage. So don't wait until it's too late. Schedule that yearly eye exam, because prevention and early detection can save your sight. And while you're here, comment below if you've ever experienced floaters or vision shadows. It could help others recognize they're not alone. Now, you might be wondering, how exactly does diabetes cause all of these changes in the eyes? The main culprit is long-term damage from high blood sugar. When blood sugar stays high, it affects the blood vessels throughout the body, and the tiny vessels in the eyes are especially vulnerable. Over time, high glucose levels weaken the vessel walls, making them leak fluid or blood. In some cases, the body tries to grow new blood vessels to replace the damaged ones, but these new vessels are fragile and often grow in the wrong places, leading to more bleeding and scarring. This process doesn't just affect the retina. Diabetes can also increase the risk of cataracts, where the lens of the eye becomes cloudy, and glaucoma, a condition caused by pressure building up in the eye that damages the optic nerve. Both of these conditions are much more common in people with diabetes than in those without. And here's the important part. You can lower your risk by controlling your blood sugar, blood pressure, and cholesterol. Studies have shown that even a modest improvement in A1C levels, the measure of average blood sugar, can significantly reduce the risk of diabetic eye disease. So every step you take to manage your diabetes isn't just protecting your body, it's also protecting your sight. If you want to keep learning practical tips like these, make sure you're subscribed and turn on the notification bell so you never miss a new video. Now that we've covered the early signs of diabetic eye disease, let's focus on what you can actually do to protect your eyes and preserve your vision for years to come. Because here's the truth. While diabetic eye disease is one of the leading causes of blindness, most vision loss from diabetes is preventable when the right steps are taken early. And that's what I want to share with you. Real-life strategies that you can start using right now. If you haven't yet subscribed, this is the perfect time to do it, because this channel is all about giving you the tools you need to live healthier and feel in control of your diabetes. The first and most powerful step you can take is managing your blood sugar levels consistently. It might sound obvious, but it truly makes the biggest difference. High blood sugar damages those delicate blood vessels in the eyes, and keeping your glucose in a healthy range reduces that damage dramatically. Research shows that every 1% drop in your A1C level can reduce your risk of diabetic retinopathy by as much as 35%. That's huge. For example, if your A1C is 8% and you bring it down to 7%, you've already made a significant impact on your eye health. This doesn't mean you have to be perfect all the time, but aiming for steady, consistent control, rather than big ups and downs, goes a long way. If you find this motivating, hit that like button, because every step you take to manage your blood sugar is protecting your sight. Alongside blood sugar control, another critical habit is keeping your blood pressure in check. High blood pressure puts extra strain on blood vessels, including the ones in your eyes. Studies have shown that people with diabetes and uncontrolled high blood pressure are at a much greater risk of severe eye complications. That's why doctors often emphasize the ABCs of diabetes management: A1C, blood pressure, and cholesterol. Together, these three numbers tell you a lot about your overall risk. Simple daily steps like reducing salt intake, staying active, and managing stress can help lower blood pressure naturally. Even a daily 30-minute walk can make a measurable difference, and if your doctor has prescribed medication, taking it consistently is key. Remember, this isn't just about your heart, it's also about protecting your eyes. If this resonates with you, leave a comment below with one small lifestyle change you've made to manage your diabetes. It could inspire someone else. Another powerful step is prioritizing yearly eye exams with a dilated retinal check. This is one of the most effective ways to catch problems early, sometimes even before you notice any symptoms yourself. The dilated eye exam allows the doctor to see the back of your eye in detail and detect even tiny changes in blood vessels. Many older adults put off these exams because they don't notice vision changes, but that's exactly why they're so important. Eye disease can progress quietly. Think of it like checking the oil in your car. You don't wait for the engine to break down, you maintain it regularly to prevent damage. And here's some good news. If diabetic eye disease is caught early, treatments like laser therapy or special eye injections can often prevent vision loss. So make that appointment and encourage your loved ones with diabetes to do the same. And don't forget to subscribe for more reminders and health strategies like this. Lifestyle habits also play a huge role. For example, staying physically active isn't just good for your weight or your heart, it also helps your eyes. Exercise improves circulation, lowers blood sugar, and reduces pressure inside the eyes, which lowers the risk of glaucoma. It doesn't have to be complicated. Walking, swimming, cycling, or even gentle yoga can all make a difference. Pair that with a balanced diet rich in eye-friendly nutrients, foods high in antioxidants, vitamins A, C, and E, omega-3 fatty acids, and minerals like zinc, leafy greens like spinach and kale, brightly colored vegetables like carrots and bell peppers, fatty fish like salmon, and nuts like almonds are all excellent choices. These foods support the health of your retina and protect against oxidative stress that can worsen diabetic complications. If you'd like me to create a full video just on best foods for diabetic eye health, let me know in the comments. Another simple but often overlooked step is quitting smoking if you smoke. Smoking narrows blood vessels, increases blood pressure, and accelerates damage to the eyes. Studies show that people with diabetes who smoke are twice as likely to develop severe diabetic retinopathy compared to non-smokers. I know quitting is not easy, but even cutting down can improve circulation and reduce stress on your eyes. If this is something you're working on, give yourself credit. Every step counts. And finally, don't underestimate the power of rest and stress management. Chronic stress can raise blood sugar and blood pressure, putting more pressure on the eyes. Practices like meditation, prayer, deep breathing, or even spending time in nature can calm the body and keep your health on track. Sleep is just as important. Getting 7 to 8 hours of quality sleep supports blood sugar stability and helps your eyes recover from daily strain. Think of sleep as your body's natural healing time. It's when your eyes and blood vessels repair themselves. So to summarize these strategies, keep your blood sugar steady, control blood pressure and cholesterol, get regular eye exams, stay active, eat nourishing foods, avoid smoking, and manage stress and sleep. Each of these steps is like adding another layer of protection for your vision. None of them are complicated, but together they make a powerful difference. In the next and final part of this video, we'll bring everything together with encouragement, real-life inspiration, and a clear message on how you can protect your vision long-term. Because at the end of the day, it's not just about preventing disease, it's about enjoying life with clear, vibrant vision for as long as possible. Stay tuned, and if you're finding this valuable, please take a second to like this video and subscribe. It really helps us continue bringing you this kind of trusted content. As we close this discussion, I want to remind you of something very important. Your eyesight is precious, and protecting it is not just about avoiding blindness. It's about preserving the quality of your daily life. Think for a moment about the things you love to see, the smile on your grandchild's face, the pages of your favorite book, the beauty of a sunrise, or even something as simple as watching a movie or safely driving to visit a loved one. Vision connects us to the world and to the people we care about. That's why diabetic eye disease deserves your full attention, not your fear. And if you haven't already, don't forget to subscribe to this channel so you never miss the practical tips we share to help you live better with diabetes. Now let's reflect on what we've learned together in this video. The 5 early signs we covered: blurred vision, frequent changes in glasses prescriptions, difficulty seeing at night, floaters or dark spots, and empty or shadowed areas in your vision are not just random annoyances. They are your body's way of saying, pay attention, something needs to change. Too often, people dismiss these signs, assuming they are just part of aging, when in fact they may be warning lights flashing on the dashboard of your health. Just as you wouldn't ignore the oil light in your car, you shouldn't ignore these signs in your eyes. If you take one action after watching this video, let it be this: schedule your yearly eye exam and keep it a priority. That simple step can protect your vision more than almost anything else. And if this message resonates with you, give this video a like so it can reach even more people who need to hear it. I know for many people living with diabetes, especially older adults, managing health can feel overwhelming. You might already be juggling medications, diet changes, doctor visits, and daily routines. Adding eye exams and extra habits to that list might feel like too much. But I want to encourage you. Think of these steps not as burdens, but as investments. Every time you choose a balanced meal, every time you go for a walk, every time you check your blood sugar, you're not just preventing complications, you're investing in your ability to see your loved ones clearly tomorrow. That's a gift, worth every effort. If you agree, share this video with a friend or family member who may also benefit. It could change their life. It's also important to remember that while diabetes increases your risk, it doesn't mean vision loss is guaranteed. Many people with diabetes live their entire lives with healthy eyesight by staying proactive and following the simple steps we discussed. Science is also on your side. Advances in treatments, from laser therapies to new medications, are giving patients more options than ever before. The earlier problems are detected, the more effective these treatments can be. That means you have more control over your future vision than you might realize. So don't let fear stop you. Let it motivate you to take action. And if you've had a positive experience catching an eye issue early, share your story in the comments. Your words might be exactly what someone else needs to take their health seriously. I also want to leave you with a thought on mindset. Living with diabetes is not just about controlling numbers. It's about choosing to care for yourself each day. Think of it as building a relationship with your future self. The small choices you make today, like saying no to an extra sugary snack or saying yes to a 15-minute walk, are like gifts to the version of you 5, 10, or 20 years from now. That version of you will be grateful for the clearer vision, the independence, and the freedom to keep enjoying life's moments. So the next time you feel discouraged, remind yourself, you are not just managing diabetes, you are actively creating a healthier, brighter future. Before we finish, let's quickly recap. Diabetic eye disease can be silent, but it's not unstoppable. Watch for the 5 warning signs we discussed. Manage your blood sugar, blood pressure, and cholesterol. Schedule yearly eye exams. Stay active. Eat eye-friendly foods. Avoid smoking. And manage your stress and sleep. These are simple, practical steps that anyone can start today. You don't need perfection. What you need is consistency. Progress, even small progress, adds up to protection. So here's my final call to action for you today. Take your eye health seriously. Don't wait until vision changes become severe. Book that eye exam, stay on top of your diabetes management, and take small daily steps to support your overall health. And of course, subscribe to this channel, like this video, and share it with someone you love who might also benefit. Together, we can spread awareness and empower people living with diabetes to protect their vision and their quality of life. Thank you so much for watching and for being part of this community. Remember, your eyes are windows to the world. Take care of them, and they will continue to show you the beauty of life for many years to come. Stay healthy, stay hopeful, and I'll see you in the next video.